All right, welcome back to the No Morning Show, Trinidad and Tobago, and to all of you right across the world. We are so grateful to have you with us on the No Morning Show. I am Natalee Legore, and of course it's Thursday. We're in the second hour, so you know it's time for Your Body and You. Y'all have been asking us to discuss certain things, and we promise you we'll try to get through all of them over the next, year to come or so. If I'm still here, and if I'm not here, hopefully, they'll keep the program. But Your Body and You, today we're discussing postpartum depression. For those of you who have found yourself there after suffering some kind of trauma, we're here. We're going to be speaking with Dr. Marissa Edmund, who is a medical doctor but resident in psychiatry, to discuss this postpartum depression. Good morning to you, Dr. Edmund.
Good morning.
Thank you so much for joining us here on the No Morning Show. So what exactly is postpartum depression? Is it different from other kinds of depression?
Guys, hi, good morning, everyone. Thank you for having me. So postpartum depression is similar to depression that you'd have at any other time in life. The difference is the time frame in which it happens. So just of note, in terms of psychiatry, we've moved away from the term postpartum, because what we found is that the depression a woman experiences during the pregnancy period, it actually starts during the pregnancy. So it's not limited to the postpartum period. So postpartum typically is considered to be the 12 months after the birth of the baby. So that 12 months is considered the postpartum period. But what we call it now is a peripartum depression, because it tends to start even within the pregnancy. Some of the symptoms would begin.
No, Doc, you just put a whole spoke in my wheel, because now I'm trying to figure out which one of the depressions I'm going to be speaking about, if I want to go with peri or with post.
No, we could use so for the purpose of this interview, we could continue with postpartum, because that's what most people are familiar with. That's the term. I just wanted to get that out there so people would understand that it's not just limited to right as soon as you have the baby, 12 months after that. Now we know that it's even weeks during the pregnancy. So if someone starts to feel depressed,
we're looking at an extended period and a name change, but really still looking at those who experience it not just during pregnancy but also after pregnancy.
Yes.
Okay. All right. So what is a prepartum, aka postpartum depression?
Okay. So postpartum depression, usually what it encompasses is symptoms such as a depressed mood. So usually you might start to feel sad, down, and depressed, right? Along with a host of other symptoms. So it's a syndrome. So persons may start experiencing low energy, difficulty thinking. You might realize that you lost interest in activities that were usually pleasurable to you. Nothing really brings you any pleasure, as well as feelings of guilt, feeling worthless, feeling hopeless. At times you can have changes in appetite, changes in sleep. So your appetite might increase or decrease. That could be associated with weight gain or weight loss. In terms of sleep, you may be sleeping more than usual. That's called hypersomnia. So 12 hours or more sleeping, difficulty to get yourself out of bed. And then you might have insomnia, where you just can't sleep at all. So you have sleep disturbances. So in terms of postpartum depression, it's sort of a spectrum. So you have mild, moderate, and severe. So I'm telling you all these symptoms right now, but you don't have to have all. You can just have some. And in terms of the degree of the symptoms, they might be mild. So in severe cases, that's when you get issues such as you start to have thoughts about harming yourself or harming the baby. You may start to have strange thoughts that don't feel like your own, they feel foreign to you. You may start to have strange beliefs that are not true, and at times you just feel sluggish. Your mind would be slow, you have difficulty thinking and making decisions. So all of that would encompass the postpartum depression. As well, in terms of with the baby, you might start to feel anxious around the baby, feel like something is wrong with the baby, feel restless all the time, feel like you're not a good mother, you're not bonding with the baby. All of those are the symptoms that we form the syndrome of postpartum depression.
So is it that there is some chemical imbalance that happens with your body when you get pregnant that causes this?
Right. So overall, depression is considered to be partially due to a chemical imbalance. In terms of the pregnancy period, what happens is we have such high changes in the hormones in the body. So you have a large increase in estrogen and progesterone, and then when you deliver that baby, you have this huge drop in the same hormones. And there's this theory that this hormonal change is related to the development of depression within the pregnancy period, the postpartum period.
Okay, that's interesting. Is this any different from PTSD, post-traumatic stress disorder?
Yes, very, very, very different. So those are two completely different disorders. In terms of a post-traumatic stress disorder, you usually have to have a major traumatic event. It has to be life-threatening. You have to feel like your life was in danger. And the symptoms are more anxiety, fear. It's completely different. The only connection between PTSD and depression is that with PTSD, you can have some depression symptoms. So you may feel depressed at times, but the core symptoms in a PTSD would be anxiety, fear, worry, nightmares about the trauma that you experience. So it's two different disorders.
Okay. So, Doc, how, if I'm suffering from postpartum depression, how will I be able to recognize it, to say, okay, you know, something is wrong here, this is not natural? Because I know some people go through and don't even recognize or realize that, no, this wasn't the natural way for me to react to my child or to myself or to my family members.
Okay. So we can look at it as first-time mothers and then women who had other children. So if you're a first-time mother, you may not know what to expect, how to feel within that postpartum period. Now, what happens is that you might feel like, okay, you're not bonding with the baby. Okay, actually, let me restart. So in terms of, about 70% of women may experience what we call baby blues. Now, baby blues has some features like postpartum depression, but it's not as severe. It usually happens within a few days, maximum 2 weeks after delivering the baby, where the woman might be crying for no reason. You might feel restless, irritable, you can't sleep, but you're still able to get up, take care of the baby, feed baby, interact with family members. You're not as your function is not as affected as with a postpartum depression. Now, if you do feel that way, so you're feeling down, you're feeling like you can't sleep, you're crying a lot, but this is going on for more than 2 weeks, so in terms of the time period, then you start to think, okay, something's wrong. This is not just baby blues, this is more than baby blues. Things to look out for would be not wanting to be around the baby. If you feel yourself becoming like every time you're around the baby, you're anxious, you want to avoid being around the baby. You start to have negative thoughts about the baby, negative thoughts about yourself. You start to feel worthless. You find that you're spending more time in bed and you just don't feel to get out of bed. Those things should start to clue you into, okay, something might be wrong. And then, of course, you might feel this sadness that's just there and you're unable to shake this sadness. You're unable to enjoy anything that you experienced and previously enjoyed, like your favorite TV show, music. You just feel like you're always sad. That may be something to cue you in that, okay, this is more than just baby blues.
So one of the effects of a postpartum is neglect of the child.
Yes, so with postpartum depression, it doesn't only affect the mother, it also affects the child. So and also the health of the child, because what happens as well is you may not, in terms of feeding, in terms of the baby's sleep schedule, all these things are affected by a woman who's going through a postpartum depression.
And what happens to the child if we have this disconnection between mom and child? Can we see the effects of that lasting into as the child gets older, like, you know, to have behavioral patterns as a result of the postpartum?
Yes. So there are some long-term effects of babies who experience a mom going through postpartum depression. It affects their speech, in terms of their communication, emotionally and behavioral, as you mentioned. So that's why it's important for both the woman and the people around her, your partner, family members, to kind of pick up on symptoms, pick up that, okay, something is wrong here, and they can get help as soon as possible, because it does affect the baby long term.
And what will that help look like? For the woman who is suffering from postpartum, what are the treatments?
So what I would suggest, the first step would be to speak to a health professional. So whether it be usually when you go to your postnatal clinic, they do screening for depression there. You can speak to the nurses there, speak to the doctors there. If you have a general practitioner that you usually visit, if you think, okay, something is wrong with me, first you go get assessed, get screened, get reviewed by a doctor. Once that doctor thinks, okay, yes, this person is depressed, going through postpartum depression, the options are what we call psychotherapy or pharmacotherapy. So that doctor will likely refer you to one of our clinics in the country or recommend that you see a psychiatrist or a psychologist. So psychotherapy is what people usually call counseling, talk therapy. Some people may have heard about cognitive behavioral therapy, that's CBT. So one of the first line treatment for mild to moderate postpartum depression would be psychotherapy. For severe cases or patients women who have had depression in the past and had to be on treatment, they may need medication. So that's where antidepressants come in. But in terms of the treatment, it has to be a discussion between the woman and the doctor, because in terms of antidepressant, if you're breastfeeding, some of the antidepressants could transfer to the baby, and there's a very low risk. So it's important that you have this discussion with your doctor.
But are women who suffer from depression generally at a greater risk of suffering from postpartum depression?
Yes. So we can actually just touch on the risk factors. That is one of the risk factors. So a past history of depression increases your chances of developing a postpartum depression. Other things would be if you have a family member who has experienced depression throughout their lifetime or postpartum depression. So whether it be a mom, your sisters, that your chances genetically are increased of developing a postpartum depression.
And, you know, when we started the conversation, you said that the thing is they've looked at renaming it prepartum depression. Is prepartum?
Peripartum.
Peripartum, right. Sorry, I knew I was wrong, you know. Peripartum depression, because it can start as early as, you know, during pregnancy. My question is, does this affect the developmental stage of the child, the fetus of the child, the fetus of the pregnancy when a woman is suffering from peripartum depression?
Yes. So things that could happen would be you could go in, well, it depends. If you have a severe depression, can lead to preterm labor, can also lead to low birth weights in the baby. So again, this comes back to recognizing that something is wrong, seeking help, talking to your family members, and getting that help before it affects the fetus and before the baby is born. Because again, we just spoke about possible long-term effects.
So this is definitely a serious thing. But do we have the stats for, you know, Trinidad and Tobago in terms of the amount of women who suffer from, you know, whether it's a moderate to severe peripartum depression?
So I would say I am not aware. I'll definitely have to do some more research. I do know more global statistics where 1 in 7 women will experience postpartum depression. I'm not certain. I'm not sure about Trinidad specifically.
But 1 in 7 is really definitely a high number too. You know, so if that even translates into the Trinidad and Tobago context with the amount of pregnancies we have per year, we might be having some issues. But do we have support groups of people who suffer from peripartum depression?
None that I am aware of. Again, I know, so what we have available in the public system would be, we do have psychologists available, so you can get the therapy for free. There's also group therapy as well. So it's like for mothers going through a postpartum depression, but that's something, how it works, you may have to be referred by a doctor to join that group. I'm not sure about the health centers, what's available in the health centers, because they do in the postnatal clinic, nurses would be able to screen, pick up somebody who may be developing a depression, and what they do is education. So they help with coping skills, helping mom educate a mother about parenting. So this is usually would be first-time mothers who just having a very hard time and becoming depressed. The nurses would intervene within the health center.
And matter of fact, a curious question: can a man be diagnosed with this as well?
So yeah, this is it. I love that you asked that. Okay, so in my reading, I've seen that this is American statistics though, but approximately 40% of fathers develop depression within that. We wouldn't use after the birth of the baby, about 40% within that first year can develop depression. And that was an American statistic, so we can try to translate it to Trinidad.
I asked because the funny thing is I was watching a stupid show named Love and Hip Hop, and a Jamaican guy, Safari, was saying that he was so depressed after his daughter was born, and that, you know, he didn't know how to function. So I realized that maybe for somebody else it might have been a joke, but for me it translated into something that was, serious,
Yeah.
But Doc, in terms of if somebody is diagnosed with peripartum, postpartum depression, is it something that stays with the person for life? Or is it something that after treatment goes away?
Yes. So we touched on treatment before. So in terms of treatment, whether you do psychotherapy, so counseling, or medication, the treatment would go on for about 9 to 12 months. Once these symptoms are resolved, you're back to your normal self, your doctor would consider stopping the medication, and the depression, that'll be the end of the depression. Now, what it's important to note is if you do have postpartum depression, there is a risk of recurrence in future pregnancies. Or there is a higher risk of developing depression later on in your life if you experience a traumatic event. So it does affect you, but it's not like the illness would remain for years to come. It can be treated, resolved, you go back to your normal self, but it's important to know that, okay, there's a chance that this could recur.
And my final question to you, Doc, is there anything that we can do to prevent peripartum or postpartum depression?
Yes. So one of the major things that risk factors that leads to peripartum or postpartum depression would be a high postnatal stress. So it's important that within that postpartum period, you get as much support as possible. So a lot of mothers may think that they should be able to do it all. They should be able to do everything by themselves. They should be able to get up throughout the night and take care of the baby. But support is fine. So support from your family members, support from your partner, support from friends. That's one way to ensure that you're making time for yourself. And you're able it helps decrease the chances of developing depression. So reaching out for family support. You also want to ensure that you get enough sleep, because prolonged sleep depression is a risk factor prolonged sleep deprivation is a risk factor for developing depression. So it's important that in that postpartum period, especially in early months, make time for yourself, spend time with your friends, ensure that you are fueling yourself with a nutritious diet, incorporate exercising. So just lifestyle changes, getting as much support as possible, helps prevent development of
All right,
depression.
Dr. Edmund, we do have to leave it there, but I want to thank you so much for sharing your knowledge with us on postpartum. And I learned now peripartum depression.
Yes. Thank you so much for having me.
You're most welcome, Dr. Marissa Edmund, there, resident in psychiatry, talking to us about, learned a new term, peripartum depression, because she says the depression doesn't just start 12 months after the child is born, but can start from pregnancy, and therefore they're looked at changing the terminology. But some interesting facts coming out there.